Makrinov. I am a psychologist, and yes, I am fat. I am the fat psychologist. I love who I am. I want everyone to embrace who they are. Fat or skinny, queer or straight, white, brown or black, funny or boring, whatever. Saying this sounds easy. Doing it can be hard. And that's where this podcast comes in. Welcome to the Fat Psychologist podcast. Let's make decisions based on information we understand and question, and not based on what others say we should think of ourselves. In this series, I explore happiness at every size. Inclusivity is at the heart of everything I do. Every word is captured with care. You will find precise transcripts on the show notes and wherever you listen. If you like my podcast, subscribe and share with your friends. You can also find me on Instagram, Facebook, Threads, and Blue Sky at The Fat Psychologist, and on my website, thefatpsychologist.com. In today's episode, we will be thinking about therapy. I've been discussing therapy quite a lot in different episodes, and I'm super happy to be talking to Kat and Joe, who go online by the Fat Counsellors. They're based in the UK in Bristol, and they were kind enough to accept an invitation from an email to join me on the episode today. They have been working to ensure talking therapy is fat inclusive for some years, and they will be talking about their experiences and also a training that they run for everyone to challenge fat bias. The episode will be structured in the following way, so if you want to jump through, go and find the next chapters. We will start thinking about how Joe and Kat came about, the Fat Counsellors, how then they have addressed weight stigma in therapy, and how they've expanded their training beyond therapists so all of us can have access to how we challenge fat bias in ourselves and in others. We will then have a little section explaining what the role of talking therapists is, because it's very different around the world. We will compare therapists, counselors, psychologists, and other roles. Therapy has been really important to me in different countries, in Chile, in the UK, and in Mexico, where I have lived. And there are distinctions, so it's really important that if you're listening to this from somewhere that it's not the UK, you're aware of what the regulations are in your own space. We will then go into the biases that exist in medical and social contexts. So we'll talk a little bit about fat bias and the importance of anti-diet culture. And we will finalize with practical steps for inclusive therapy or for finding a fat inclusive therapist. We will then say goodbye and we'll think about what we will do in the future. If you want to participate as well, remember you can come to the podcast as a guest. You can send me questions, voice notes, and we will integrate them in the episodes. Let's then start our conversation.
Hi, thanks for having us. I'm Jo Reader and I'm a psychotherapist and supervisor and trainer. I work in North Bristol. I have had a long career working with teenagers and families in other careers, so that remains quite a big part of my current work. I also work with people with ADHD and menopause and narcissism. Those are my main specialties outside of the body image work, which I also love doing.
Would you like to tell a bit about how you met?
Our story of how we met and how we came to become the Fat Counsellors and create our training together started when I was doing my training as a counsellor about 15 years ago now. And if you come on our training, you'll hear the longer story of how I got to this point. But in my training, I decided to write a dissertation, do a bit of research on whether weight stigma was present in the therapy room and if clients can escape weight stigma in therapy. So I wrote a dissertation on that. It was sort of based on my own experiences in therapy and my own story of being a fat person from very, very young, always the biggest in the class, and all the things that came with that. I then wrote an article for Therapy Today a couple of years after I did an abridged version of my dissertation about fat stigma in therapy. Kat came across my article during her training, and she will tell you the next part of the story.
Yes, thanks, Joe. So I trained after Joe. I've sort of been all sorts of sizes throughout my life, but even when I was quite small, I was always deemed as fat. And during my training, I was trying to look at all the feelings and shame I felt around that. And I came across Joe's article, and it was reading that and the book Shrill by Lindy West, generally realizing that maybe my body wasn't the problem. Maybe it's about how bodies are treated. Later on, after I qualified, myself and Joe sort of kept in contact. Joe had done some training before on anti-fat bias, weight stigma, around how to look at that. And I said, we need to join forces. And we started off doing training for therapists, just therapists only, because we realised there was such a gap in training. There's nothing about bodies, regardless of what anyone's bringing, what discipline, anything. Everyone is bringing a body to the room, and it's just not there. What we realised actually is everyone needs to know this. So now we've split the training. So part one is for everyone. It's just around anti-fat bias, what it is, what it looks like, how to unlearn that body shame, because there's nobody who's safe from this. People in fat bodies and bigger bodies are treated much worse, but there's generally anyone who isn't safe from this kind of bias. Anyone can come to that. And then the part two was more targeted. Now you know this, how is the best way to be with clients in the room and different ways of doing that.
One of the things we realised when we first just started doing it with therapists is that there was so much personal work to do first. That's why we've divided it now up into two separate courses. To start with, people come and explore their anti-fat bias, their internalised fat phobia, and we give a bit of a history and of anti-fat bias and talk through body acceptance. And the second course is when people come and do some work about how to work with it in the therapy room.
What you're saying makes a lot of sense with my personal history as well, because it's the story I'm hearing from a lot of people, particularly living in fat bodies. I was always seen as fat, although really looking back, I wasn't.
Mm.
And then the internalized fat bias and the fact that I believe I'm worth less, and that other
Mm-hmm.
people tells me the same, and then how we work with that, and then that, I suppose, in your work goes beyond into how that then permeates the works that some therapists do. So it's great that you've
Yes.
extended your training to anyone.
Absolutely. Absolutely. We initially realised that therapists need to have done their own work. In our training, we're taught to make sure we have good self-awareness of our own biases and prejudices, and yet bodies aren't talked about in that way in training. Then what we realised that there are people who might want to go to therapy or just might want to explore their own body image can come along to that first course because it's not catered towards therapists, although many of them come so they can come on and do part two.
Brilliant. For our audience as well, who might not all be English or British or whatever.
Mm.
Because I'm not, I'm from Chile, and actually, based on what I'm seeing from listeners, where they're from all over, which is lovely.
Mm.
Having come to the UK as a migrant after studying, I call myself psychologist because I am, and I am an organization psychologist, not a clinical psychologist, and not a counselor.
Mm-hmm.
So I wonder if it's worth us explaining to our listeners in the UK
Mm-hmm.
or other countries, if you're aware of how this works and what a counselor does versus what
Mm.
a clinical psychologist does or any other psychologist, if that makes sense.
Essentially, we've been saying therapists a lot, but what we're talking about is counselors and psychotherapists. So they're ostensibly what's known as talking therapy in the UK. So it's generally one therapist with one client, unless they're doing group work, looking with them normally around their history, around what's happening there, looking at anxiety, depression, any sorts of things, grief counselling, whatever's happening for that. In England, when we do our training, most good training says that you need to have your own therapy so you can look at your own stuff, because the danger is between you and your client, you're at risk of bringing too much of your own stuff into it or not being able to clearly see what's happening because it's all too mucky. Whilst as in, if I'm with a client and there's a bereavement, maybe I've experienced bereavement in the past, of having looked at those things going, oh, I know how I felt about that, those feelings are mine, I'm going to put them to one side and be with what's happening with this person. That's where you do the work. And what we've realised is, unless people have actually done that, there's not that look at bodies and how bodies are supposed to be societally. In the UK, we have a National Health Service, And the very nature of the medical advice and a lot of the community, although it's getting better, is very anti-fat bias. It's used for literal gatekeeping.
I don't know if you saw this because I saw it today.
Mm,
An article in the newspaper online that looked at something that we all know already, but the kind of medical bias. They were saying around 65% of people in the UK are classed as overweight or more. A third of the trusts in England, I think it was, I might be misquoting the number, do not perform certain operations on fat people. So bias is
mm,
everywhere.
Mm-hmm.
And if it's there on counseling where you're going to talk to someone,
Yeah.
so I've been telling
mm,
people a lot in the podcast that it's really important to seek help and seek support. It's helped me
mm,
a lot in my life, and that's partly why I wanted the clarification, because in the UK, counseling, talking therapies are done by trained counselors. Is not the same as a trained psychologist, and a
mm,
clinical psychologist in the UK has much more specific hospital related
mm.
approach
Yeah.
than a counselor does. Like, for example, in Chile, where I'm from, a psychologist would be the same as a counselor. We don't have
Right.
that distinction. So you couldn't be a counselor without being a psychologist.
Hmm.
Mm.
But
Yeah,
in
it's
the
very
UK, it's a different training
non-clinical being.
process. And
Yeah.
so it varies a lot in different places. And hence, I thought it was important to clarify that.
Yeah,
Mm,
Um,
absolutely.
and then, same with your experience in terms of bodies. I came across fat liberation really late in life,
Mm.
probably the last 5 years.
mm,
And I was very much bought into fat phobia and the fact that I had
Mm.
to lose weight if I wanted to be
Mm.
accepted and loved. And it was
Yeah.
all
mm.
on me.
Yeah.
And that
Yes.
changes, doesn't it?
Well, it does,
It
our
really
first
does.
workshop is predominantly what we explore with that, about that understanding of how we've been told to and conditioned to think about our bodies, and this is quite global now. It was much more Western at one stage, but it is quite global now. It helps explore where the roots of this anti-fat bias stem from, so that we can start to get people to just stop and think about these assumptions we have. They've become really baked into our culture. And so there is really internalized hatred and shame about our bodies. If they are big, or as you were saying, the large majority of the population are over that threshold set by the BMI, which is not a useful tool for anything. And so we help people unpick the roots of that and to start to consider thinking about their bodies in different ways, because this sort of conditioning and
Mm,
brainwashing is so prevalent in our society. It's everywhere you look. It isn't just medical. It's
Yeah.
when you want to go to the theatre and can't sit in a seat, or on a plane you can't sit in the seat. You want to get medical treatment, you can't get that. It's how fat people are portrayed in the media. We do a whole thing on our workshop about all the different ways. And I mean, it just medically, the thing that churns me up the most is how people can't get fertility treatment or trans affirming surgery,
mm.
gender affirming surgery because of BMI. I mean, let alone people needing a hip replacement. It just makes me very angry, that bias. They're very much needed life saving surgery that people need.
Yeah.
Angry because it's a complete and utter barring of our rights, actually, medical rights.
Yeah, part of the structure of the course is, as Joe said, history of where it comes through the roots of the transatlantic slave trade that happened colonially within England and Europe, through to the present day and how that happened. Part of it is unwrapping that and actually allowing people to see themselves beyond their bodies, but also for those who tend to have what is known as thin privilege, as in are in a body that's not gate kept, where you can fit in most things, about the difficulties that people face when you're in a bigger body. Because something that we always say is you can't self-love your way out of oppression. I can think of myself as highly as I do now, and I love that, but it's not going to buy me much better treatment within surgery. It's not going to make a seat bigger. With activism, I feel much more empowered now to say this is the wrong size for me, to test out professionals beforehand saying, I'm a fat person, so I need robust furniture, and is this a problem? So I know it's safe and I'm not wasting my time where somebody's all right and then they're being awkward and then they start mentioning my diet. And it's just like, I don't want to have this conversation. It's dehumanizing. I'm a person. Don't think about what you think I might eat or my lifestyle is. I'm not a before picture. In the age of Ozempic, especially now, fat people are seen as a before picture. I'm a human being right now. Treat me as such.
Yeah, and also for many of us, just something we are, and it's not something we can or want to even.
Mm,
But even if we did want to, it's not something that we can easily manage, as
yeah,
like
No,
these
or
assumptions that
need
people
to.
make, or need to
yeah,
There's
exactly,
a,
or need to,
yeah,
or want
yeah,
to, or like why
mm,
should
yeah,
we? You know?
yeah,
absolutely. Absolutely, and there is a massive assumption in society that if you are fat, that you must be wanting to do something about that.
Yeah, and
sorry.
it's
Yeah.
something that you should be doing. So I don't know
Mm,
if you've experienced this, but it's like a
oh, yeah.
moral high ground. Like being thin
Mm,
is morally better in our
yeah.
society.
Yeah.
I disagree with that, but that's how society sees it, I think.
Oh, absolutely. And that's the other thing. A common misconception with the work that we do is that we don't like thin people. No, we love everyone. Or that we're upset if anyone wants to go on a diet or if anyone wants to use Ozempic or any of those things. And none of those things are the case. The argument around that is about people have the right to exist in their body regardless of whatever size that is. And the thing is, as well, is if an individual says, I want to be smaller, especially if it's for gatekeeping methods, like I need to get this surgery and I want to have children and they won't let me otherwise, those sorts of things, or I just want to fit in things and be treated better, then there's absolutely no way we would be
We
damning about.
understand.
Yeah,
Yeah, yeah,
why not?
yeah.
It's about giving that information around the diet cycle, about actually how hard it is to keep weight off, to get rid of the shame when that doesn't happen. We're already seeing the bounce back with Ozempic that as soon as it's people are off it, the weight's coming on, and
Yeah.
that's biology. But it's always seen as personal failure.
Yeah, and I think that to me, my worry with a lot of these trends is that actually, when we look at the literature,
Mm,
we only know in the literature normally what happens in a very short period of time, up to three
mm,
years normally. And any research that goes beyond tends to show that whatever method we use, and
Yeah.
actually particularly quicker with Ozempic, will
mm.
put the weight back on.
Yeah,
Not everyone, and that's the bit where it's complicated because we're
yeah,
looking at general data rather than.
Well, and we don't know. We
But
don't know enough about that yet. Anyway, we haven't got enough evidence.
yeah.
Yeah.
mm,
And I think there's two things I was going to say then. One was just to be clear that we are anti-diet, but we're not anti-people who diet. You know,
So
your
what?
body, your rules.
How would you define then anti-diet?
that we would never promote it as people or as practitioners or encourage clients to do that. Part of being a therapist is being as neutral as you can, bystander, but also that you notice if harm is happening. So, say, and I've had this before, where clients like, I want to go on a diet. I'm like, okay, tell me how that is. And they just reflect it, and actually they feel fine and they are well, and generally it's not affecting them. Then good, great. And we don't need to talk about that. When I talk about noticing harm is when they're like, I need to go on a diet, and you're like, why? And it's like, because I've been told to, I have to, I want to, and then they get obsessed and upset about calories and things, and it's like, again, it'd be like, what I'm noticing is how this process is making you feel, and I'm concerned about that. But they get to choose what they do.
Yeah, it's observing to them what we're seeing before us, really. But we wouldn't have any kind of agenda with a client. And that's what we are training other therapists to not have an agenda, but to have an awareness of diet culture.
Mm,
And because of what we know about diet culture and how problematic it is on so many levels,
mm,
particularly for health, it's helpful for people to understand that history. They've got a choice then, haven't they? Clients and therapists, the people we work with, have a more informed choice
mm,
to decide what you want to do with your body and how you want to treat it.
mm-hmm,
Aubrey Gordon, who is an amazing fat activist, author, and podcaster, says diets haven't worked for 5 decades. They're not going to start working now.
mm,
And what we do know, as you were just referencing, Ninna, is that in the longer term, the evidence is that dieting is much more harmful to our health,
mm,
much more. And so, as therapists, we would not be promoting something that we
mm,
believe has been proven to be harmful.
Absolutely. And I imagine the other thing that as a fat person, and it's never happened to me in therapy, to be super honest. So my therapists have never picked or been horrible about
Good.
fatness. They haven't even been surprised with my stories, or they haven't
Mm,
shown it, which is brilliant. But I imagine another thing can happen because I've seen myself have this reaction when I've learned more about anti-racism, for example, and I was super shocked. And
Mm.
if a
mhm.
therapist doesn't have the knowledge, then they
Yeah.
might be asking those same questions or
Yeah.
not believing our experiences
Yeah.
Mm.
or questioning the fact that it might have been a bad doctor rather than a general thing or
Mhm,
or
mhm,
invalidating what we're seeing or not even seeing it if they haven't thought about
mhm.
it, particularly if they have not shared our lived experience. And of
Mm.
course, I don't expect a counselor to have shared all my lived experiences because that's impossible.
No.
Um,
Yeah.
Training's for, isn't it, to update our knowledge? And
Mm.
that for us is we know that this is such a given fact in our society that fat is bad, fat is unhealthy, and dieting is good. It is slightly changing, but it is still very embedded. Yes, I mean, it's barely changing, and I think we're in a
I
different
think it's
culture
getting
again.
worse with
Yes,
Ozempic
yes,
now. It's
Mhm.
yes, yeah.
everywhere.
Well, of course, we are in a, yes, sort of post anti-diet place right now. And as therapists, therapy should be one of the very most safest places to go
Mm.
to be free from judgment
Mm.
and for your therapist to be able to have good self-awareness of their bias, for it not to be
Mm.
unconscious. And what we have quickly realized is that because it is not discussed and it's baked into every part of our society, therapists haven't stopped and thought about this too. And I'm so glad to hear you haven't experienced that, Ninna,
Yeah.
but it is really common.
I mean, I can
And
only imagine because
Mm.
it
yeah,
happens when I go to, not so much in the UK
yeah,
as well, but in doctors it happens.
exactly. And therapists, like anyone,
Mm.
if you haven't done any work on this and explored the bias and understand a different perspective to it, that unconscious bias seeps into the work and it happens even just in that kind of post Christmas. A client might be saying something about everything that they ate, and the counsellor will join in because it's just part of the settling into the set. Oh, I know, yes, I need to cut back this month or whatever. You know, it's so normalised to talk around bodies and
Mm.
food like that that it is happening.
Yeah.
Yeah.
Um, you know, in very subtle ways and very well-meaning ways, bonding.
More saying, oh, I've been good,
Mm,
or this is bad. Or imagine, as a client, maybe they lost a lot of weight and they said, oh, I've lost X amount of weight. And the therapist goes, oh, great, that's so good. Well done. Congratulations. Put a
Yeah.
value in it. You've already said your
less
before weight
biased.
was wrong. This one
Yeah,
is right.
yeah,
And then if it puts on, then you already know if you ever tell them that your
yeah.
therapist thinks that your body is wrong now.
And that's so harmful, this rhetoric in society about praising weight loss, because
Mm.
although people feel good or likes praise, right?
Mm.
It's what's not said. It's what's not said when that isn't going on. You're regaining the weight, and everybody will describe that. Even though they're hearing the praise, they're kind of going, "Oh, so you had a judgment before?"
Mm.
And it's damaging for everyone, not only
Yes.
those of us who are fat. Because I just read a study that on a review showed that 100% of studies that had studied depression and fat bias have
Mm.
shown
Mm-hmm.
a correlation. And
Mm-hmm.
it's at every weight. So it's people who are thin are still
Yeah.
struggling with this, in trying to
Mm.
not
Mm,
be big. And those of us who are big
Mm.
are sometimes judging ourselves unless
mm,
we've done the work and are going,
Mm.
actually, not my problem, yours.
yeah.
But even then, it's hard to do call ahead to see if there's reasonable
Yeah.
adjustments. So I've started doing that when I go to conferences. I need a big seat, so let me see the space, because otherwise, what's my point going? People, even when they're really accommodating, I've ended up sitting in the back of a room with a sofa for myself, and it requires a lot of
Mm-hmm.
self assurance to
Mm-hmm.
be in that
Mm-hmm.
space because you're more seen
Yeah,
even.
yeah, you have to be extremely resilient. Well, the more I do this work, people can get really on board with realizing how toxic this culture is around the anti-fat dialogue and the noise. But even when we've done that work, we still have to place ourselves back out into the world where we are not meant to fit. It's not been designed for us. And however resilient we are, like you say, that
Mm.
image of I've been given a sofa, thanks, but it's at the back. This is going to be bloody obvious while you're sat on your own on a sofa and you're isolated, excluded again. It's not
Mm.
inclusive.
Yeah,
No.
It's a step, but it's still not inclusive. It's very painful.
yeah.
Mm.
If you were thinking of anyone who's going to a talking therapy,
Mm.
what would be the advantages of going to a counselor that has been to your training or has had this knowledge? It doesn't need to be your training necessarily,
Mm.
versus someone who's not informed on fat bias, fat liberation.
I'll start with the practical stuff. The practical thing is we ask everyone to look at their chairs and think about them and think about how accessible they are, especially those in private practice. It's a bit harder when it's provided by the place, but still advocate for something better. And we also say put on your website or a picture of what it looks like so people have got an idea of quite how accessible it is. We've got much better with disabled access in terms of wheelchair access and doing that. It needs to be more. It's just saying, here is the space, here are the steps, here are the wideness, this is how it is. That's
It's the accessibility, isn't it? And even having that on your website shows that you've
yeah.
thought about it. And the advantage is you're not going to have to squeeze into a chair week after week after it doesn't fit. I mean, it's number one, isn't it? Number one, you feel comfortable. And the fact that it's been thought about, you know that you have been thought about, literally.
I had someone cry at assessment because I said to them, look, just to let you know, here's the chairs, here's what the size of them are, this is my body size, I fit in that, do you think that's going to be okay? They were like, nobody's ever asked me that before, ever. Just such a small difference. But I'll let Joe speak through what it is like then, just the experience of being with a therapist who's done the training.
Therapists have been through our training. We can say with confidence, we can guarantee they are not going to accidentally prejudice you. They are going to be aware and they will be open to challenge. And it will be a really safe space, particularly if you're in a body that is far less socially acceptable. You can go without having to worry that your therapist is going to accidentally or not so accidentally, deliberately cause harm. The safety in going to a therapist and talk about that, and you're not going to get someone going, oh, you're not fat, you're beautiful, which is just the worst thing, FYI. Anyone listening, never say that, because you can be both, for starters. But also, our bodies aren't here just to decorate the planet. So, which is my personal catchphrase. It's the safety of going and knowing those awkward comments or side glances or, it just is true safety in a non-judgmental space around bodies. At the end of the day, we've all got a body. There's a hierarchy of body in our society. Let's not pretend there isn't. We encourage the therapists that work with us to talk about that in the room and how to do that in really gentle ways. And we know that clients prefer the congruence and openness of these conversations, gently, sensitively, to happen rather than not happen. Things being unsaid is far worse.
It's the elephant in the room, isn't it?
Exactly.
Talking about that, that's something I normally ask at the beginning of the podcast, and I completely forgot this time. When you were introducing yourselves, many of the people who will be listening to the podcast won't be seeing us. So, can you please both describe yourselves physically?
Oh, yeah.
So, who'd like to start? Joe, I know you need to go, so how about you go first?
Oh, okay. How would I describe myself physically? I am a white female. I'm 5'5" and fat. I've got brown curly hair. Well, it's quite grey these days. I still say brown, which is interesting, isn't it? Predominantly brown. That's how I describe my body.
Brilliant.
I'm a white cis female with, I don't know what colour my hair is at the moment because I dye it too much. Short curly hair. If you think about the categories, I think it's like what you call a mid fat. So a UK clothes size between sort of 24 to 28, depending on where you're shopping. Because that's the thing, when you always see the head and the shoulders, you don't really know.
Yes, what Kat's alluding to is, I don't know if people have come across it, something called categories, which is. Have you come across it, Ninna?
Yeah, I mean, explain it as well, but I did cover it in detail in episode 2. But go for it.
Okay.
Go for it for a quick intro. Yeah.
There's a spectrum, obviously, of fat. It's not just like you are over this and you are all fat. Like there's still a spectrum of sizes, and with that becomes privilege and access, of course. And Kat and I both, I'm size 24, 26 UK dress size. We still have a lot of privilege of being able to shop these days, buy clothes, and just about fit into seats. We recognise that.
Because I'm around the same. I'm like a 22, 24, and I can still fit in most seats. Maybe not as comfortably, but I recognize that privilege in relation to others are bigger.
Exactly.
Obviously.
Oh, yeah. And it's so important to understand that too. It's not just all fat people have the same issues, but it is talked about like that.
And there's the intersections of it as well. I've got privilege of being
Absolutely.
white, able-bodied, cisgendered, yet middle class. Or as soon as you add all those intersections on, more oppression.
Yeah, and we are centering fatness in this discussion, but it doesn't mean that we've forgotten the rest.
No,
Because
absolutely
again,
not.
it's really important that when anyone, so I do encourage people to go to counseling, therapy, coaching, which is different again, that is done in that environment where someone else can guide us, having thought about all of these issues, because being fat inclusive also requires us to be race aware and to be gender aware. And Joe, you've mentioned that already, and all of these issues, because I don't want to do the same blunders, which I will keep doing, because even with anti-fatness, even being a fat person,
Of course.
I still have things to learn.
Yes.
But at least be aware of my biases, or be able to be told, this is a bias, Ninna, pick it up.
It's
Exactly.
having that openness to be questioned. I'd say that for anyone, regardless of when you're with a therapist, I'm always like, ask them the question, even if it sounds rude, because if they can't answer you as to how they practice or why without defensiveness, then that doesn't bode well.
You know where you stand. Yeah.
Brilliant. And if people then wanted to find a counselor that's aware, in the US, we might look at something like a health at every weight practitioner, which we don't have so much in the UK. So, particularly for those in the UK now, where can they find you in particular, and where can they find others?
Okay.
So, again, Joe, would you like to go first? Because I know you need to go in 4 minutes.
Yes, thank you. We do have a Facebook group called the Fat Counsellors. If you're a therapist, please come and join that, and you can hear about our training and things like that. You can find me on Facebook, and my website is joreader.com. I'm the Fat Acceptance Therapist on Instagram. And as with Kat as well, anybody can get in touch with us and obviously can work with us, but we can also signpost people. We hold a list of people that have done our training, and some people are happy for that to be shared.
Yeah. Also, we have a website. It's thefatcounsellors.co.uk. So there's details of all our courses, how to get hold of us, all those things. At chappell.co.uk as well. And as I say, we've got a network. Future plans is to make some sort of database of practitioners who have done the training, but that's on our expanding to-do list.
Just to say about our training, we do an online weekly 6-week course in September and October each year. We've got some spaces left for that. If anybody's interested in that, so please go on our website and have a look or contact us. And then we do the part 2 for therapists in January, February time. We also have an on-demand, so people could just buy and do in their own time, don't need to come to a course or a group to do it. They can buy part 1 just to do at home.
Brilliant. Is there anything else you'd like to say? Anything else you'd like to share?
No, I think I just wanted to thank you for inviting us on.
Yeah.
It's great. It's sort of broadening the sort of fativerse, as it were. I remember the excellent film Your Fat Friend by Aubrey Gordon. They encourage people to promote their fat positive endeavours, like counselling, the gym, everything. And I think it's the more that we can connect and communicate, because it can be quite isolating. So great to meet you. And
it's been brilliant to have you both, and it's great to know many other people who are doing this work in the UK, because what I've seen, there's so much more of this in the US than there is here. And I am meeting some people in the UK. In my podcast, I'm speaking for people from everywhere. However, being based here, it's really nice to have a community. And there are some communities, so I will put some links to communities I'm aware of, as well as your work on the show notes.
Community is so important in all of this, and it's what people often talk about on our courses, that to be with other people, and like I felt that today, to be with people who get it and they're coming from the same position, don't you? Don't need to talk for long to know that, like, oh yeah, we're coming from the same place. So it's been really nice to meet you, and hope we can connect up.
Yeah, I hope we can do some other things together. One of the things that I really want to do, and you mentioned Aubrey as well, because I think everyone has who's in this movement, but I really want to have a screening of Your Fat Friend.
Oh yeah,
which would be fun. We could do one in Bristol and one in Birmingham. We can do 2.
Yeah.
I already have all the details, but it'd be super fun.
Yes, it would be. Well up for that.
Okay, I'll be in touch then.
Oh, good to
Great.
connect with
Oh, it's
you.
lovely.
It's
Great to
great
hear
meeting
from
you
you
both.
too.
Thank you so,
You
so
too.
much. Bye.
Cheers and
Bye.
bye-bye.
Bye.
Bye. Bye.
That takes us to the end of the episode. I hope you really enjoyed today as much as I did. Remember to like and follow the podcast wherever you listen. If you want to be in touch, I am at The Fat Psychologist on Instagram, Blue Sky, and Threads, also on Facebook. And you can get in touch also through my website, thefatpsychologist.com. I am actively looking for sponsors, so do get in touch if you'd like to sponsor my work. In the next episode, I will be talking to another therapist, and we will be discussing issues around representation or lack of representation thereafter. I hope that you can join us again. This episode was produced, recorded, and edited by Ninna.